go. All right, hey everyone, welcome. I'm Rabbi Hilly Haber, and I'm so grateful to all of you for being here. To everyone in person, thank you for being here in person, and everyone online, thank you for tuning in and joining us. I think we're going to have a wonderful conversation tonight. It's sponsored by our Central and Action Leadership Team, of which Scott is our chair, and he's also our moderator for tonight, and also the New York Jewish Coalition for Criminal Justice Reform, the JCRC, are co-sponsoring with us. So thank you. And we're so grateful to you, Ames and Insha, for being here. You will learn more about Ames and Insha throughout the night, but really thank you both so much for the work that you do and for joining us. If you have questions, there are note cards and pens on your chair, so feel free to jot down questions. I'll come around maybe halfway through the program and just start collecting them, and we'll see how many we can get through. So thank you all so much, and Scott, thank you for moderating.
Thank you very much, Rabbi. All right, well, everybody, really, let me just extend a second thank you for coming out tonight. Very excited about the conversation that we're going to have. So for those of you who don't know me, my name is Scott Resnick, and I co-lead the Central and Action Committee with Amy Glickman, who's seated up here in the front row. And excellent, big round for Amy, big round for Amy. It was also her birthday about 2 days ago. So we've had the the real fortune working in this group, along with under the guidance of Rabbi Haber, to focus on issues which the congregation believes helps create a better city. To sort of make Central a sort of ambassador for Jewish beliefs and values, and looks to impact, New York City in a way that's positive. So we've done some, exciting work with the congregation on food insecurity. We have a great breakfast program. We have a community refrigerator program. We've worked on refugee resettlement, where some of our congregation members have done absolutely incredible work, helping to resettle, refugee families here in New York. We've done work, on the environment and the like. But the group has always had a great interest in the issue of criminal law reform. And looking towards our criminal justice system, which has, given us a system of mass incarceration, which is, not what you would expect of a country that, founds itself on liberty and freedom. We've been very interested in looking for ways to sort of advocate for different criminal justice reform measures that we believe make the city and the country a better place. And certainly in the last few years, I think criminal justice reform has had its moment, and there's been some absolutely great progress. A lot of the projects that we've worked on here at Central, including bail reform, raise the age, parole reform, clean slate that we're currently working on, have had real positive impacts in efforts to try to make the criminal justice system more fair and more equitable. But I think we've also seen that, especially since the pandemic, the city has begun to feel less safe. Crime has increased, and there has become a sort of tension a little bit in the dialogue, which is, on one hand, we have issues of public safety, and on the other hand, we have issues of criminal law reform. And the idea that these are sort of two opposites is something that we have worked hard to sort of combat, what we believe to be a misconception in that space. And tonight, we really want to focus and have a really great conversation about the idea that criminal justice reform actually makes the city safer. And we want to sort of look at that question from a number of different angles, and we are incredibly blessed tonight to have two real thought leaders in that space up here in the front of the room with me. Ames and Insha are both, leaders in this space. Ames is with the Brennan Center for Criminal Justice at NYU. Insha's with the Vera Institute of Criminal Justice, two organizations that I would say are real gold star, think tanks, advocacy groups, and they're very data-driven. So I think a lot of what we're going to talk about today, when we look at the interplay between public safety and criminal justice, is going to be rooted not only in experience, but in observable statistics and information. So Maybe we could start off with just a big round of applause for our two guest panelists. Excellent. And without further ado, we're going to get right into the program. And as was pointed out by the rabbi, you do have note cards on your seats. So if you have any questions, feel free to jot them down, and we'll leave some time at the end. All right. Okay, so I'm going to start out. Ames, you're going to get the first question. All right. So since the pandemic in 2020, the city, as I've mentioned, has felt, for many New Yorkers, has felt less safe. In April, the House Judiciary Committee held a field hearing here in New York City, and it was focused on the victims of violent crime in Manhattan. And if you listen to that testimony, the city felt very, very unsafe. I also read the New York Post every day, which makes the city feel very, very, very unsafe. And so I was wondering if you could give us all a sort of baseline understanding of trends in crime here in New York since the pandemic. In which direction have they moved, and in which direction are they moving?
Absolutely. Oop. Does this work? Uh-oh. You can click it up. So much easier. All right, very good. I want to say, first of all, thank you, Rabbi Haber, and thank you to Central Synagogue in general for having me. It's such a pleasure to be here. Thank you for moderating, and always glad to share a stage with Insha. So I actually want to start with one point that I've heard you make many, many times, which is that everyone deserves to feel safe in their home, in their city, in their neighborhood. And the reality is that crime has risen since the pandemic, since 2019. And I'm going to get into exactly how, but it's important to understand, first and foremost, that people are right to be concerned about that. The question is just, what do we do with that concern? How do we orient it to solutions that can build a safer city and a safer country as a whole? So just to start with some base level statistics. In New York City, the number of murders jumped by around 40% between 2019 and 2020. That's a really sharp and significant jump. I have a lot of thoughts on crime data. If you want to get into Q&A about the reliability of crime data, happy to. Murder statistics are rock solid, so there's no real question that those numbers reflect reality. The trend in murders started to level off in 2021, started to decline in 2022, but at the same time, some other major offenses, robbery, burglary, motor vehicle theft, continued to rise through 2022. So those are real trends, and those are real concerning trends. However, I want to put those trends in context with three things. Number one, it's not just New York City, not by a long shot. So when you look around the country, this is something that happened at every level of government, at cities, villages, towns, every state, red or blue, and in the nation as a whole. So nationally, the murder rate increased by 30%. The assault rate increased by 10% as well. So that's context point number one. Context point number two, things are by no means as bad as they used to be. And I give that point softly because I think it can lead to complacency, which I don't want to suggest. And I don't want to suggest that we should look to the past and say, well, it's not 1990, and therefore things are fine. Not what I'm saying. However, just to give you an idea of how far we've come since 1990, which I did not live here in the city in 1990, but I know many people who did. And the past is a foreign country. Just to give you an idea, just one data point, in 1990, 1991, the number of murders in New York City topped 2,000. At the peak of the pandemic increase in murders, it was around 480. So even when the city was at its most recent spike in homicides, it was significantly safer than we were in 1990 and 1991. And that's a huge point of progress. Oh gosh, I said three. What is the third? We'll start there.
I think that's good, and at any point we could sort of throw in the third.
Yep.
We'll make it look very organic too when we do it. So I guess one of the things I want to just ask you, Aim, just as a quick follow-up, in the work that you've done, has there been a correlation, that you've seen between the criminal justice reforms that have taken place during the same period and the rise in crime statistics?
We've spent a lot of time working on this at the Brennan Center, and so the answer, just to put it very bluntly and briefly, is no. There's no correlation that we've seen between the prevalence of criminal justice reform, the adoption of certain criminal justice reforms, and the rise in crime. So it's important to know, when you look around the country, you sort of think Is crime up much more in New York than it is in some other states that are more conservative and haven't gone as far as we have in some criminal justice policy changes? And moreover, if those cities, if those towns are doing better, is it because of their policy differences? And the answer is just no. Across multiple valences, across multiple different changes in policy that you can look at, you don't see that jurisdictions that are, quote, tougher on crime, and I don't like to use that phrase because I don't think tougher is actually always good. I think it just is, to a degree, performative. But jurisdictions that are, quote, tougher didn't fare much better during the pandemic. So red cities, red states, blue states. Two of the things that we've spent a lot of time thinking about are the growth of the progressive prosecutor movement and the growth of pretrial justice reforms. Both have been blamed in the press, I think, as a driver of crime and violent crime across the country. But when you actually look at the evidence, it starts to fall apart. So there are two really good studies that I could go into detail with you all on if you're curious, that have looked at how have crime trends changed in cities where law enforcement is led by a, quote, progressive prosecutor, like Larry Krasner, like Alvin Bragg, versus a more traditional mainline prosecutor. And there's no difference. It would be tempting to say, well, actually, there is a difference in crime is lower in those jurisdictions, but it's not even that. They can't establish any sort of statistical link between those two things. Similarly, when you look at bail reform, and there's a lot of data on this that I definitely want to get into more as the night goes on, but it's especially tough because when you talk about bail reform and pretrial reform, there are like 60,000 different ways you can change pretrial policies. But broadly, states that have adopted pretrial reforms, like New Jersey, my home, or other states around the country like that, you don't see a relationship between the adoption of pretrial reforms and crime trends. And most of the research that we see coming out of New York State shows the exact same thing. So on net, for example, there's a great new research paper out by the folks at John Jay College. I know these people, I've worked with them. They are just they do incredible research, best in the business. And what they found, they also don't sugarcoat things. So I'll tell you more about some more interesting findings in the study later on. But they found that eliminating bail in New York for misdemeanors and lower level felonies actually led to a decrease in rearrest rates in comparable cases, which I think is sort of an inversion of what we expect, and it sort of stands that narrative on its head.
No, excellent, and that sort of, I think, leads into the question I'd like to sort of switch over to Insha for, is if criminal justice reform isn't, sort of driving crime rates up, do efforts like bail reform, parole reform, efforts to reduce prison populations, do they actually make the city safer? And, sort of following up on what Ames said, I was wondering if you could share with us your views on this, Insha.
Well, first of all, I want to echo Ames's thanks for having this conversation. I hope it's truly a conversation and a discussion. Scott started by saying, criminal justice reform can make us safer. I happen to firmly agree with that, but I bet there are people sitting here and watching in who might be a little skeptical of that claim, and we should actually dig into it because I think it's really important to just have the honest conversation. And before I answer your question, Scott, which I will, I just want to add a few thoughts to what Ames really smartly described in terms of the data and offer something a little bit more qualitative about our perception of safety and crime and whether or not we're safe, which is, it's really a feeling. None of us determine how safe we feel or what is happening with crime based on statistics. Most of us in our day-to-day couldn't tell you actually anything about crime statistics other than we have a feeling that they're up or we've seen a headline. And so the first thing is crime and how we perceive our neighborhoods and whether they're safe or not are very much shaped by media. And another thing that has happened since 2020, and we saw this especially with the election of Mayor Adams, and since Mayor Adams has been in office, he has been talking about crime a lot, and media coverage of crime and individual outlier cases, but horrific, horrific cases are on the front page of the news much more than they used to be, and that shapes our perception of, are we less safe? What is going on with crime? Why does the city feel out of control? The other thing is how the streets look. I think all of us would agree that in New York, especially since the pandemic, where basic services shut down, where everybody sort of went remote, people who needed mental health care, access to housing and services suddenly lost their safety net, and we see more untreated mental illness, homelessness on the streets. And whether or not that is actually to do with crime, it certainly makes us feel like there is a disorder, and that also affects our sense of safety. And so those factors of our perception of what we're seeing, the media and our elected officials and politicians talking about crime, all really are what shape our sense of, are we safe more or less so than where we used to be? And so one of the things I say often, and Ames and I talk a lot together on panels, so you'll hear us just say, as he said, as I said, is it does a disservice to blame the wrong cause on what is driving crime and what actually makes us more safe. What we have seen is in a number of places where they have rolled back criminal justice reform, it actually hasn't improved public safety. So that's something we can say, which is rolling back important progress that all of us who share values around safety and justice believe in doesn't actually help deal with the problem. But we do have a problem, and it's on all of us, and it's on our elected leaders, it's on the media to accurately cover what is driving crime so that we can actually identify the right causes and find the right solutions. So in short, if you blame the wrong causes, you miss the right solutions, and we are no safer as a result, and that is a failure. And so that's why I'm so glad we are having these conversations. To your point, Scott, there is a fascinating statistic from the research, and this research has been done in many different ways, and it's basically that the fact of incarceration itself, even 23 hours in a jail cell, actually makes it more likely that somebody's going to be arrested again in the future. So in the sort of criminal justice reform business, there's a term called criminogenic, which means exposure to a particular factor will make somebody more likely to be arrested, to engage in criminal behavior. Incarceration is criminogenic. And so as a matter whether or not you believe in justice reform or not, if what we are aiming for is public safety, jail and incarceration is actually a pretty poor investment in public safety. And when we talk about crime, when we say, we can actually invest in things that prevent crime before it happens and not just react after, people start nodding. They're like, yes, I would like that. I don't just want a system that reacts after somebody engages in criminal behavior, somebody already falls into the criminal legal system, and we are just going through the process of arrest, prosecution, jail, rinse and repeat. And so that's really where the opportunity is. And things like criminal justice reform, bail reform, parole reform don't quite address that prevention piece, but what it does is allows for redirecting resources, investments to say, we have fewer people in jail as a result of bail reform. We actually have more people that we can connect to mental health services, to housing, to other factors that stabilize them, and that actually prevents the future cycle of crime. So that's sort of a long, convoluted answer, but I hope it sort of gets to what's actually driving the concerns about crime and why justice reform, like bail reform, like parole reform, actually open up an opportunity. They themselves do not prevent crime, but they allow for us to use our resources, invest differently, have a different system that's about prevention first and not just reacting after.
No, thank you, Insha. And I'd like to follow up on a point you were making, and that's about mental health. We were supposed to have the city commissioner, Dr. Vasan, here tonight. Unfortunately, he was unable to attend. For those of you who mistakenly thought I was the doctor, my mom thanks you. But the issue of mental health is so closely associated with, criminal justice, with public safety. I was wondering if you might be able to sort of address, some of the factors that go into mental health treatment. There's many who'd say we're in a mental health crisis here in New York City.
I mean, I think all of us can relate to this where, during the pandemic and after, probably all of us are less well. We read in the newspapers every day that our youth are in the middle of a mental health crisis. We have an untreated sort of mental health, need across this country. And that's for those of us who have the resources and the access to actually figure out, can we do something about it once we get past the stigma? For folks who are in the criminal legal system who face arrest, things like that, they are the least likely to access services and yet the most likely to need it. And that intervention actually makes the difference between whether or not they stay on the right side of the law or not. And the challenge around mental health is a few different things. One is just simply actually getting connected to services. So New York City, more so than most other cities, has a tremendous social safety net, has a very good homeless services system where at least there is a right to shelter in this city. It also, there is, sort of Medicaid and Medicare coverage for everybody if you need it. But the challenge is for somebody who is unstable, not connected to treatment, not in stable housing, they don't know where to go to actually access mental health treatment, and that is a huge problem. And it's too bad that we don't have Dr. Vasan here tonight, who is the New York City Health Commissioner. I've known Dr. Vasan since he was at Health and Mental Hygiene, really thinking about how do we create a system in the city where there is no wrong door. Every door is the right door to get access to mental health services. Right now, our jail, Rikers Island, has about 6,000 people there, and at least 19% have serious and persistent mental illness. That's 1 out of 5 people. And that is a much smaller number than the overall number of folks who have a mental health need that has gone unmet and likely undiagnosed because they haven't ever gone through the right front door to actually get a diagnosis, get connected to services, get connected to medication. I started my legal career as a public defender in the Bronx, which is one of the poorest districts in this country. And the thing that I would see time and time again for my clients who are in front of me, sometimes facing their 50th, 100th arrest, was, we have missed the opportunity, those 99 arrests before, to actually connect them to services. And another 15-day, 30-day stint in jail is not going to change anything. We're going to be right back here. And there were a number of times where we saw connecting somebody to services, whether that's housing, whether that's treatment, was the thing that made a difference and prevented that 100th arrest. And so that's really what we have to do, the challenge we have to do, and it's one that I hope we have an opportunity to really address, because in a way that we've never done before, because of the pandemic, we are talking about mental health as a need that needs to be treated. I think we are finally beginning as a country to address the stigma. And the other stigma that sort of coexists for people who face arrest and are in the criminal legal system is the one of, an arrest, of oftentimes a criminal record. And so those are the sort of competing factors that make it hard. And I think the real work there is to try and make sure that there's no wrong front door, that every door, even the matter of an arrest or being in court, is an opportunity to connect somebody to services, because one more time in jail simply will not make a difference.
Thank you, Insha. And Ames, I'm going to sort of pivot then over to you, sort of kind of following up on that sort of idea as to kind of getting people the right help or through the right door. Based on your work, what sort of criminal justice reforms have you found have been not only effective, but in your view, have added most to public safety?
Definitely, yeah. Whoa, a little too much.
It's good. Put an extra battery in there for you.
Speaking of which, I remembered number 3. Number 3 point of context about...
In that case, could you tell us what number 3 was, Ames?
Thank you so much, Scott. I'm glad you asked. So number 3 is that crime trends actually look to be declining this year. So but for 2 major offenses, most major offenses tracked by NYPD have tipped into negative territory as of the last time I looked, which is just before I came here. Which is great news. That's not, to say that, things are 100% better, back to where we started. There's a lot of ground to cover to get back to where we were in 2019. And even then, I want to just make a note that, the level of safety that we think is acceptable in this country would be shocking in a lot of other countries. When New York City's murder rate was at its lowest, it was double that of London. And if you read the pages of The Economist, you'll hear people saying, oh my gosh, the murder is out of control in London. And you look at the data and compare it to New York, oh my gosh. We need to think much deeper about what sort of public safety system we actually deserve and what policies will get us to, not just where we used to be, but something much, much better. And that might involve a real paradigm shift. And it's going to be tough. But now to go to your question, I'll answer. Actually, that connected a little bit, kind of. Yeah.
I thought that was really well done.
Thank you.
Very well done.
So one of the things that I've been most interested in lately, and that I think you'll see a lot from my colleagues at the Brennan Center writing about, is the so-called minor offense system. So if you study some about how the criminal justice system works, we have two levels of offenses. Felonies are more serious crimes, misdemeanors are less serious crimes. And there's a tendency to sort of write off lower, quote, lower level offenses like misdemeanors as, they're just sort of, it's not that big of a deal. But that's not at all what the data show. The data show that misdemeanor records are hugely damaging, hugely altering the life course. And I'll give you two examples of how we know that. So Rachel Rollins was the federal prosecutor for the Boston area, and before that she was the local prosecutor for the Boston area. She got a promotion from state to fed. So she ran a program where she declined to prosecute some types of lower level offenses. So a really smart researcher named Anna Harvey, who I'll tell you more about in a second, she and some of her colleagues ran a study that said, what happens when we do this? What happens when, just by random selection, like a prosecutor chooses not to pursue a misdemeanor case and a prosecutor chooses to pursue a misdemeanor case? Like, what sort of divergence do we see? And their results show that the people whose cases are declined actually go on to have fewer arrests in the future going forward. And she did 1,000 little statistical tricks to kick the can on these results and say, like, is that really what the results are showing? And they hold. Like, they hold really, really, it's a really, really interesting finding. I spoke with her at the Atlantic Festival last year. I'm going to refer you to that, not to boost myself, but because you should really see Anna talk about it herself. She's absolutely astonishing. So that's one thing we know. And if you talk with her a little bit, what she's really found is that it's that initial criminal record acquisition. It's the minute you get a criminal conviction on your record, like Insha was saying, that it completely changes your life path. You might get kicked out of public housing. You might not be able to find a market rate apartment. You might lose your job. You might not be able to find a job. You might not be able to get a promotion to help you, advance your career. It really changes the way that your life outlook materializes from there. So to talk about Brennan Center research on that subject for a second, my colleague, Dr. Terrian Craigie, and I worked on a paper a couple of years ago where we tried to identify, what is the economic effect of a criminal record on annual earning power. And we found a few things that didn't surprise us and a few things that did. So the one that didn't surprise us and that, frankly, we sort of expected this is what we would find. As tragic and as tough as it is, it aligned with our priors, if you will. So we found that spending time in prison is hugely damaging to economic potential over the long term. People who've been to prison earn about half as much as people who haven't after controlling for a battery of other factors. What surprised us was when you focus on misdemeanor convictions, that number drops to 16%. So people who have a misdemeanor conviction are still missing out on 16% of their earnings relative to very similar people who don't have a misdemeanor conviction. I did not expect it to be that high, and I think it just goes to show that what we think of as minor records are really no such thing. So to get back to your question, what do we do about it? There are a couple of really promising programs, all centered around sort of blunting the way the misdemeanor system affects people and saying, like, do we really need this person to be involved in the misdemeanor system, or is there some other way to do it? One is Project Reset, really exciting program. What it does is before when you're initially approached by police and given a desk appearance ticket, which is in lieu of arrest, you're given the opportunity to complete some community service programs. They vary by site, they vary by person you're working with, but if you complete it, your record never happens. You never got an arrest, you never got a conviction, it's just gone. This program is, preliminary results are pretty promising. What I think is most interesting is the funding for this project has never been entirely stable. Like, a lot of these really promising interventions run on a shoestring budget, which is a shame. We should invest in things that work. So when Project Reset's budget came under peril in the middle of the pandemic, all 5 Metro DAs wrote an op-ed in the New York Daily News saying, if you believe in public safety, fund this program. So you have 5 Metro DAs signing an op-ed saying, help us not prosecute misdemeanors. I think that should really tell us something, number one. So that's number one. I think that's really, really important. And number two, I'm going to touch the third rail a little bit, which is, the data really show that misdemeanor bail reform has worked. If you look at that data from the study I mentioned, that show that rearrests are down for cases where bail is no longer eligible. I'm not here to tell you bail reform is perfect. I'm not here to tell you we've figured out everything about how pretrial justice should work. I think it's an enormously complex area of policy, but parts of it seem to be working pretty well, and I think we should those wins and acknowledge them as real progress.
Oh, thanks. And, so I'll go sort of to the next third rail that we have.
All right.
Okay, which is Rikers Island. Okay, city's biggest jail, a history of mismanagement, violence, federal government looking to take it over. I think there was about 19 deaths there last year. I think there was just another death, I think, 2 weeks ago. And the question comes down to, what makes the city safer, right? Is it investing in jails to sort of increase capacity, or is it in sort of closing down Rikers and looking for alternatives? And Insha, this comes back to you, and you sort of hit one of your favorite quotes. I have a favorite quote of yours from one of your Times op-ed pieces, which was something to the effect of the idea that it may be counterintuitive, but putting less people in jail makes places safer than putting more people in jail. So I was wondering if you could sort of apply that analysis to the Rikers Island problem, and you could solve it in the next, 3 minutes.
So it's a both and. We both need fewer people in jail to make us safer. And just as context, in New York City in the early 1990s, there were over 20,000 people in jail. And today, as I said earlier, about 6,000. That's how much we have decreased our reliance on incarceration. During that same period of time over the long haul, murder rates have gone way down, as Ames shared, and so has pretty much every other measure of crime rates and public safety. So we can, in fact, have fewer people behind bars and be a safer city. New York City has already done it. We can do it some more. But the second piece is, what do we do with people and how do we treat them when they are incarcerated? Because there will always be some number of people who are not safe to walk amongst us and will be incarcerated. And that's where Rikers really just fails us, and it is beyond saving as it is. I don't know how many of you have ever walked around Rikers Island, but it is something else. And I've been in hundreds of jails and prisons over my 2 decades working on justice reform. And still, the feeling that I have when I walk into Rikers and just the desperation, the violence that you feel literally in the air, it's unlike anything else, and it does not have to be that way. So my organization, Vera, we actually bring corrections commissioners and elected officials to Germany and Norway to look and see what incarceration looks like there. And the thing that I hear from every single trip is, well, this feels like a college campus. And indeed it does. People have a basic sense of human dignity. They have autonomy. They get to wear their own clothes. They get called by their names and not a number or just their last name. They make choices about how they spend their day. They either work or take classes. Everyone has a safety net that when they're released, and they get released a lot sooner than we do here in this country, when they're released, they have money for first and last month's rent. And because they've been working while incarcerated, they have a job they can go to. They have far lower recidivism rates than we do. They do so much better with public safety. And there is a plan that was passed by the last administration, championed by the city council, to try and create some measure of that here in New York City, close Rikers, create smaller jails in each of the boroughs, to actually try and do more of that Germany-Norway effect. And we know this from the data and the research. We can do incarceration more safely, as well as continue to push forward on things that actually have fewer people behind bars.
Oh, excellent. Thank you, Insha. Just a quick public service announcement, because the rabbi told me, and I do what the rabbi says. Those of you have the index cards on your seats. If you have questions, now would be a great time to start passing them towards Rabbi Haber, who will sort of come around at the end of the rows. So think about that while we continue. But thank you, Insha. I was wondering if you might be able to sort of just kind of follow up that great analysis. I think one of the problems is people, or a lot of times will say, well, how does reducing a prison population make me in the city safer, right? It seems like such a distant place, and knock on wood, I haven't had to experience that. I've never walked around Rikers or had a family member do it, and they may feel, why would it impact me as a law-abiding New Yorker?
Well, when it comes to public safety, incarceration should be our last resort because it's actually the most expensive and it's the least productive for long-term public safety. So just as a matter of if we all share a value around safety, which I know we do, the fact that for a very long time in this city, incarceration was the first response. That's why we had over 20,000 people in jail. And we have moved away from that, and we have seen the city get safer. And so, again, it goes back to the research that I cited. The report that I like to cite literally looks at over 1.5 million arrests and comparing if people spent time in jail or not, what happened. And the people who spent even a day in jail were more likely to be rearrested in the future. I mean, it's just the data is amply clear that incarceration is not great for public safety. So that's really, I think, where we need to start with this conversation, to say the status quo approach of more incarceration will not lead us to more safety. And then to Ames's point, there are great programs in New York City like Project Reset. The other really incredible investment that we've watched New York City and other cities across the country make in the past couple of years, especially after the murder of George Floyd, was to say, who's the right first responder? So we're not just automatically relying on, again, not the right response. And so for a mental health crisis, for example, over 20% of calls to 911, and there are 240 million a year in this country, over 20% are just mental health crisis calls. There's no allegation of violence or a weapon or anything like that. And what we've seen cities do is actually send a trained specialist and not the police, because you want the right first responder in that moment, right? And what we've also seen is in places like Denver, there's a great study by Stanford University that found if you have a mobile crisis response team where you have, again, a trained mental health and substance use professional responding to a person who's homeless on the street who seems to be decompensating, or somebody who's acting disorderly but isn't really committing a crime, if you actually connect that person immediately to services as opposed to arresting them and prosecuting them, you literally see crime and rearrest go down. The Stanford study found that in the neighborhoods in Denver where they had this program, it's called the STAR program, rearrests went down by 32% compared to other neighborhoods where this intervention wasn't available. So there's solid data that a different approach, again, one that prevents crime, keeps people out of the system, is actually the best investment we can make in long-term public safety.
Oh, that's great. And, I know both of you do work, not only on a local New York City and state level, but on a national level. And I'd like to go to you, Ames, and maybe talk about taking a step back and looking from a federal level. What initiatives have sort of improved public safety from your perspective in this space?
Definitely. So first I want to note something, a note of optimism, which I forgot who I was speaking with, but we could really use some optimism in this space. So I think there's a tendency, I've read about some of the work on rebuilding prisons around human dignity. I think some of you might hear that and think like, yeah, it works over there, but we're on this side of the Atlantic, doesn't work over here. Actually not true. So there are new programs, many of which are being run by the Vera Institute, that sort of apply that approach here, and they're really promising. I was at a research conference in DC last week. NIJ, which is the research arm of the Federal Department of Justice, really has their eye on this stuff. Like, I think there's actually a lot of promise, if you want to talk on it briefly.
Yeah, we just got results back from an RCT, which is a randomized control trial. It's the gold standard of research. We run these facilities here in this country after we take corrections leaders to Germany and Norway. We say, we too can do this here. And so in Connecticut, we've been running a facility like this for young adults, so actually some of the most challenging population to have in jail and prison. And what we found is, as a result of our program and these young men being in a program where human dignity is the operating principle of how people spend their days, how you deal with discipline, how you deal with violence. What we found is the rate of violence in these facilities is a fraction of what it is in a regular jail or prison. And again, the randomized controlled trial had our units compared to other units within the Connecticut corrections system. What we also found, though, is for corrections officers, their satisfaction was so much higher working in this setting, because they go in and day out. And if you go to work every day afraid of whether you're going to make it out alive, that is terrible for your own sense of well-being, your own mental health. And the mental health and the satisfaction of these officers is another reason for us to actually invest in a different way of doing corrections when we do need to incarcerate people. So thank you for the shout out, Ames. But yeah, the data is really promising, and the fact that we can do it here, and it's not only liberal Connecticut, but in South Carolina and Idaho and Colorado, we've done the same thing. It's really possible.
Yeah, it was really exciting. I sat in on that presentation where they sort of unveiled it. It was very cool. So I'm going to give you one more sort of note of optimism. So over the course of the pandemic, when the pandemic first hit, Congress passed this bill called the CARES Act. It let the federal government and its various agencies do a bunch of sort of creative things to accommodate to the pandemic and the realities that it brought. So one of the things that it did was it let the director of the Bureau of Prisons, the federal prison system, say, this is too hard for me to handle. I need the authority to transfer some people out of the four walls of a federal prison to home confinement, ankle monitor, things like that. It let him sort of do an end run around the otherwise existing legal limits, so he could put more people in home confinement than he otherwise could under the law. So fast forward 2 years, how did that go? The answer is really well. I just checked the data again just before I joined you all today. So 11,000 people were transferred out of federal prison, out of the four walls of federal prison to home confinement under the auspices of the CARES Act. Of that number, 400-ish were sent back to federal prison during the pendency or during the course of that program. Does anyone want to guess how many of those 400 were sent back to prison for a new criminal offense? I'll take one audience guess. No one? All right, it was 17. So a shockingly low number.
I was going to say 17.
Perfect. Yeah, it's a lovely number. It's a prime. What's not to like? Yeah. So, there are two ways to look at that result. You can look at it and say, like, well, of course you had low recidivism. You picked the precise people who could handle being out of prison, and you put them out of prison, and of course they flourished. But, like, yes, kind of, but let's put a twist on that. If what you're telling me is that we have the tools at our disposal to figure out who doesn't need to be in the four walls of a federal prison, but who can be safe on home confinement, and we don't have the legal tools to do that currently outside of a pandemic, that's wild. We should have those tools on a permanent basis going forward. And I think there is some push in Congress. I don't know that it'll go very far, but there is some push in Congress to sort of make this expanded home confinement program permanent. I think it's a real policy success story and something we should be learning from. And it's definitely increased public safety because it means people can be back with their families and working too.
Excellent. No, thanks, Ames. And I think we're gonna move into sort of our bonus round now, because we're getting some great questions from the audience, and some of these are really sort of good, challenging questions. So I'm gonna read them, and we can divvy them up. Okay. First question. I'll sort of make it into two parts, but I think they're related, so I'm going to give you both at the same time. Question. We hear constant stories of crimes being committed by people who have committed prior crimes, that they are arrested and just released again and again. Whose fault is that? Okay, first part, and I'll ask the second part of the question. Are police not arresting crime perpetrators because they say there is no point, since they will just be set free or released again anyway? Is this true in your experience? All right. Insha?
I can take the first and second part. So first of all, bail reform, as the law currently stands, if you are arrested and released under bail reform and then you are arrested again, basically at this point, after several changes to the law since it first went into effect in 2020, you can have bail set on the new case or even on the old case. So this idea of there's a revolving door and it doesn't matter how many times you get arrested, it's just simply not true. It is, though, a talking point that people who are opponents of bail reform use liberally. And the thing is, most of us don't know the ins and outs of the penal code and the new law, and so it's easy to hear that. It's easy to hear police officers say, well, what's the point of even responding or arresting when this person's just going to be out in the street doing this again tomorrow? Well, there is actually a reason to respond, which is, again, to use that moment of an arrest to actually connect somebody to the services that will break that cycle so it's not just a rinse and repeat. And there's an opportunity to do that in each of our courtrooms in New York City. There's pretrial services, which is, I would say, the single most important investment when it comes to bail reform that we have not done nearly enough of in New York State. Ames brought up New Jersey. New Jersey passed bail reform in 2017, and they spent a lot of money, but still far less than jail would cost, spent a lot of money in pretrial services. And what they have seen now, 6 years into bail reform, is the jail population has declined by almost 1/2. Crime has not gone up because of bail reform. And in fact, there is widespread support, including among law enforcement, Governor Chris Christie signed that law into effect. He's a Republican. There's a lot of support for bail reform, and every time there is the political sort of machinations of we need to roll this back, it's bad for public safety, you have the Chief Justice of the state Supreme Court in New Jersey saying, no, we need bail reform. You have the Attorney General there, the Chief Prosecutor saying, no, we need to keep bail reform. So we know this, that the data and again, the experience that we've had of bail reform, it works. It is good for public safety. It doesn't, sort of drive a revolving door. But it is an easy talking point, especially for folks who are opponents of reform and want to see it rolled back anyway. And so I urge every time you see that headline to look beyond the headlines and to actually read the overall statistics, look to the reports that Ames mentioned at John Jay College, the reports that the Brennan Center has done, that we at Vera have done, and actually get behind those headlines to look at the real data. And then also push for more investment in things like pretrial services, which it just clearly is the thing that works to actually help people at the moment of arrest interrupt the cycle of being arrested again.
Yeah, I have very little to add to that brilliant answer. The only thing I'll say is I think what I think people need to remember is that there's sort of a difference between the law as it's written and the law as it's implemented. We've spent a lot of time over the last 3 years combing back over the statute books to tweak how the law is written. There's not been nearly as much attention as to how the law is implemented, and that gets exactly to what Nisha's talking about the need to fund and build out pretrial support services. Governor Hochul's put some money to it, certainly not enough, but I think that's a really important point.
Very good. And we're just going to keep getting tougher as we go along. This is good. It's a good group. Okay? I have not heard the word victim tonight, not once. So how does sort of the concern for victims of crime factor into criminal justice reform in the analysis? So I added that little part to it, but it's a good question.
Yeah.
So
I'll start. I have some thoughts on this. So one thing that we see from hearing stories of people who have been victims of violent crime and from just the data is that perpetrators of violent crime are highly likely to have been victims in the past. And I think that goes back to the point that I was saying a little earlier about what we really mean by safety and how we can build a more holistic sense of safety. Like we unless we have some sort of system that can build a real form of safety and sort of break links of violence before they perpetuate themselves along the line, we're going to have more and more people who are victims of violent crime. And so I think building a sort of system that breaks those links in the first place, gets people the support they need, gets victims of crime the services they need as well, can help break the chain of violence. That's really hard to do, but there also is a lot of work being done on it. I'm thinking of Patrick Sharkey. Patrick Sharkey is a Princeton sociologist who's done a lot of work on trying to envision a new way forward on public safety. Some of the things that he's researched are community violence intervention programs. So these are, they can take many forms, but I'll give you one example. One example is programs that go to the bedside of people who've been victims of shootings and talk to them about what happened, talk to them about what they need to get back on their feet, both medically and mentally, and how to make sure that there's no retaliatory shooting. Because you really can sort of track chains of shootings from one shot to retaliation, et cetera. So these sorts of services are real smart investments that, they are about victims, but they're also about breaking chains of victimization as well.
I'll say I actually think we've been talking a lot about victims. When we talk about preventing crime, it is precisely to prevent that next victim. It is possible to prevent crime. And so I think we are very much talking about victims. And I started my career, this is many years ago, working in a domestic violence shelter. And the thing that I would see time and time again is that what is currently on offer for many victims, which is you can go forward with prosecution and you might end up prosecuting and losing income from the person who's the breadwinner in your family. It is very hard, again, to access services. The wrong front door exists also for victims and getting victim supports and services. And that, at the end of the day, in this current system, the status quo, if a victim wins and is heard, that means somebody has a conviction, somebody is incarcerated, but it doesn't actually address the harm, the violence, the trauma that happened to that person. And so, when we're talking about doing justice reform so that we actually open up resources and make different choices and investments, that's really about having a victim-centered approach. Because the thing that I heard 20 years ago when I worked in a DV shelter, and what we see from all the research is the number one thing that victims want is not a conviction, not incarceration, not more prosecution. They want what happened to them to never happen to them or to anyone else again. So that is what we're talking about when we're talking about crime prevention. We are talking about victims.
Great. No, thank you both. Do you have time for another question? Okay. Here we go. What is a non-incarceration response to a person who commits a hate crime targeting a specific group? Okay. Sort of it's a good tough question. Okay. So, you guys are both brave. Typically if I was in law school, I'd have my head down on this question. But you guys are both making good eye contact. So we'll go, Insha?
Sure. I joked with Amy that we were probably both the law students who sat in the front row. I was definitely that law student. Amy says she wasn't. I don't believe her. But so, excuse me, the right response to a hate crime is to figure out what is driving that person's behavior and to make sure it doesn't happen again. When bail reform first went into effect in New York, many of you will remember Tiffany Harris. So Tiffany Harris got arrested the first time for assaulting 3 Hasidic women on the street. She was released. And then just a couple of days later, she assaulted another Hasidic person on the street. And that just kept happening. And what frustrated me so much was the paralysis we saw of like, well, we can't do anything, bail reform. Yes, we can. We can intervene. And you know what? Ms. Harris has a diagnosed mental health need that was wildly untreated. She was homeless. She didn't have anything that looked like services. So when I'm talking about services, it's not a sort of namby-pamby, sort of soft on crime approach. It's actually making sure that that second assault, that third assault, in fact, that first assault never happened, right? And so that's what I think the right response is. And there are going to be instances, and we've seen them. My family is Muslim. We have certainly experienced as a community our own, instances of being targeted because my mother wears a hijab, so do most people in my family. And, whenever we talk about, like, what's the right response when that happens, it's, again, that we don't want this to happen again. We want it to stop. And so I do think there are really important interventions, like actually, again, meeting people's mental health needs, but also having more education in our schools about what drives hate, what drives tolerance, thinking about what's online. We know this. So much of sort of the division in our society these days is really driven by people not actually talking to each other and not being able to have meaningful disagreement. And I think there's just a deeper systemic problem that hate crimes are really just the small symptoms of that we really need to get at. But there is an immediate response, and then there's a longer term response that we owe ourselves as a society to take on.
I sort of want to jump on that to confront a sort of meta-narrative. Like when Insha and I are talking about criminal justice reform and different solutions, you alluded to this just now, when we're talking about different solutions to crime and violent crime and acts of hate, we're not saying no consequences. We're not saying that we support a revolving door. We're saying how you stop the revolving door through different tactics. So I just want to sort of make that baseline point very clear that we're not talking about no consequences. We're talking about different consequences that build a sort of more enduring form of public safety that might look different from what we've done in the past, but that might be more effective in the long term. Sort of one jumping off point too is, excuse me, I also have a 3-year-old, and she brings exciting colds home from daycare, but I'm not contagious. It's 3 weeks in the past, probably it's just lingering, but I digress. I think one of the things that we need to think about too is we need to sort of parse the difference between short and long-term solutions to public safety. So I talked about Patrick Sharkey a little earlier. I highly recommend reading basically anything he's written. He did a great interview on the Ezra Klein show if you're a podcast type person. He talks about a way we invest in communities to prevent crime from happening in the first place. to provide people the tools they need to feel truly safe, and that goes beyond just the absence of crime, but the presence of safety. And those sort of investments take a long time. And the best time to make those investments was like 10 years ago. But the second best time is we should do it now. And I think that's sort of what you're getting at too, is like if we invest in our communities, if we invest in opportunity, we can have safer communities down the line, and those will really pay dividends down the line as well. But just want to underscore, we're not saying no consequences, we're saying a different type of systems overall.
Great, and I tell you, our time is going really fast. So our final sort of question I'm going to throw out to the both of you. We have city council elections are coming up soon. And I was wondering if there were bills or issues that you think would be very important for people interested in this topic to be paying attention to. So kind of a speed round.
Yeah.
So right, Ames, you're first.
Clean Slate Act. So I'm going up to Albany tomorrow with Rabbi Haber and many other people to advocate for the Clean Slate Act in New York. What this does, very simple, I'll keep it quick, is that after 3 years for a misdemeanor, crime-free, 3 years crime-free, your misdemeanor criminal record is sealed. After 7 years, a felony record, your felony record is sealed. So what that does two things. Number one, it opens up your options for housing. It opens up your options for jobs. It can really give you like a meaningful second chance that is so often denied to people in the justice system today. The second thing it does is the second thing that it doesn't do. It doesn't impinge on public safety. So if you look at recidivism data, as I spend a lot of time doing, the data is extremely clear that if you have gone 7 years without committing another crime, the likelihood that you're going to commit another one is vanishingly unlikely, like comparable to average person on the street. Recidivism rates tend to peak around like 3 to 5 years as well. So it's entirely consistent with public safety. It will help build stronger, more economically vibrant communities. You read really awful stories. There's one in the New York Times this morning that I highly recommend reading about a woman who had a conviction from 24 years ago that stopped her from getting promotions, stopped her from getting jobs, stopped her from getting housing. I just don't believe that's the sort of society we should live in. I think it's the waters we swim in that we're sort of used to it. Of course, the criminal record is forever. That's just the way it is, to quote the Bruce Hornsby song. But that's not the way it is. Like in many other countries around the world, the criminal record is not forever. We just have internalized that that's the way it is here, and it doesn't have to be. So I'm super excited to advocate for the Clean Slate Act tomorrow, and I think it's a really powerful bill.
And in terms of changing the way it is, Oklahoma has passed Clean Slate, so has Michigan. We can do it here in New York. I would say city council, they are one side of the coin that manages the city's budget, which is $103 billion, and spending more of that money on housing for people with mental health needs and who are involved in the criminal legal system. Again, great investment in public safety, and more mental health services. And there are lots of city council members who care deeply about this, but hearing from all of us, their constituents, that this is a priority when you are back in office makes a huge, huge difference. And you don't have to wait until the elections in November to advocate for that, because the city budget is literally getting decided. It will sort of go into overdrive in about a week and gets decided by June 30th. So calls right now to your local city council member and to the mayor's office are incredibly valuable. They matter.
Yeah.
Excellent. Well, thank you, Insha, and thank you, Ames. And really, thanks for everybody who came out tonight to sort of participate in this. It's a complicated issue, and I think the way we all educate ourselves is by hearing all different views. And I really would love a great round of applause for Ames and Insha, who I thought did a wonderful job tonight for us. So thank you. All right. So, Rabbi, if there's any final word.
I also want a round of applause for Scott, our moderator tonight. Thank you, Scott. Yeah. And Ames and Insha, thank you so much for being with us, for sharing your expertise, and not just tonight, but for always having your door open to me when I'm looking for talking points and stats and I have questions, and to so many of us in the room. So thank you for the work that you do and for your partnership always. Yeah. Yeah. I also want to thank Will, who's running our tech back there. Will, thank you so much. Yeah. And Julia Tokotsky, who organized and coordinated all the logistics for the event tonight. Thanks, Julia. And really to everyone, thank you for being here. Thank you for your great questions. We'll send out the resources, especially the statistics and studies that Ames and Insha were mentioning. Thanks to everyone who was watching. And I'm so grateful to have a conversation like this and continue a conversation where we can talk about reform and also the ways that reform must be responsible for safety. So thank you. And we are here together to build a safer and healthier New York for all New Yorkers. And I'm grateful we can do it as a Jewish community together. Thank you all.
Great job.
That was awesome. Thank you. It was a lot of fun. Thank you.